Concussions happen every day. Hi, I'm Heather Bouchard, and I'm in my third semester at the University of Florida studying biology and neuroscience. The research I hope to one day find a career in is involved with traumatic brain injuries and second impact syndrome. Traumatic brain injuries are commonly referred to as TBIs, whereas second impact syndrome is known as SIS. TBIs occur when an individual receives a hit to the head that causes the brain to bounce into the skull. This pressure can bruise or even tear parts of the brain tissue. Many times, the ions and chemicals in the brain can be thrown out of balance. Another consequence of head trauma is when blood flow to the brain is restricted. This minimizes the amount of oxygen it receives, which is necessary for any body function. TBIs are commonly called concussions. Mild ones can experience headaches and sensitivity, whereas more serious ones can leave permanent damage to an individual physically and mentally. Second impact syndrome occurs when an individual receives a second hit to the head in only a short time after experiencing symptoms of the first. SIS can have devastating and lasting impairment on thought processes and memory. This can be due to the production of free radicals. Free radicals are molecules that are missing an electron and have been known to play a role in brain damage. My interest in this started after personally having to see a neurologist. According to the Center of Disease Control, over 1 million people visit the ER every year after experiencing a TBI. That's a lot of people. Even with the high rate of injuries, there is still just very little understood about brain trauma. The current treatment for a TBI mainly consists of rest to allow the brain to heal, and focusing on prevention of SIS. The research I would love to focus on deals with HBOT. This is hyperbaric oxygen therapy. In this treatment, pure oxygen is breathed in, and the blood then carries it through the body. Currently, HBOT is used to help body tissues heal faster. Using this treatment on TBIs is fairly new, but has high hopes of diminishing swelling in the brain and helping patients recover quicker. As I mentioned earlier, after experiencing a head injury, sometimes the amount of oxygen to the brain is limited. With more research on hyperbaric oxygen therapy and the brain, we can expect promising results. Traumatic brain injuries spread just past the individual and impair all aspects of life. I would love to be part of the future solution. Thank you.